Good evening, everybody. Okay, in today's class, let us try to discuss some important questions from Gpat, which were previously asked in 2020 as well as in 2021 paper. So let's begin the session without wasting time. So let's go with the first question. This is somewhat important question. Let me read out the first question. Polygraph PGP, there is a very important protein called PGP, which is called P glycoprotein. This P glycoprotein is highly expressed on which tissue is the question. PGP is expressed on which tissue? Option A is lungs, option B is pancreas, option C is superficial columnar epithelial cells of ileum and colon, and option D is heart. So to solve this question, let me tell you some important points about PGP. First thing, PGP is called polyglycoprotein, which is named as PGP in short. PGP is also called as multi-drug resistant protein 1, which is called MDR in short, or it is also named as ATP binding cassette subfamily B member 1, which is called ABCB1, and P glycoprotein is also named as cluster of differentiation 243. So these are different names of PGP. Polyglycoprotein is also named as MDR1. It is also named as ABCB1. It is also can be called as CD243. So these are different names of PGP. So what is the importance of this P glycoprotein? Actually, see, we have some tissues. Example, let me tell you, I'll take one cell of the liver. Just imagine this is a cell of liver. This is liver cell, hepatocyte. On hepatocytes, we have some specific transporters, some specific proteins. That proteins will sometimes allow the drugs to go out of the cell, and sometimes some proteins will allow the drugs to enter into the cells. In those proteins, PGP is one protein. PGP is one protein which will allow some toxins to go out of the cell. Actually, PGP proteins or P glycoprotein is the protein, or it is a transporter which will efflux the drugs which are present in the cells. PGP proteins are those transporters which will allow the xenobiotics. Xenobiotics means toxins or drugs or some other unwanted compounds. Those unwanted compounds are effluxed or ejected out of the cell. So that is the function of P glycoprotein. And this P glycoprotein is mainly present on epithelial cells of the intestines. Mainly they are present on the intestines. In intestines, just imagine this is a intestinal cell and this is intestinal lumen. In the intestine, especially in the ileum and colon, if this cell has any of the toxin, that toxin is effluxed into the lumen of the intestine through PGP. So PGPs are those transporters which are mainly present in the intestines, which will allow the excretion of toxins from the cells into the lumen, and from this lumen it will be excreted through feces. Out of the body it will be excreted. So the first location of these PGP molecules, PGP proteins, are intestines. They are also present in liver. In the liver, they will efflux the xenobiotics into the bile, and through bile it will be again excreted into the duodenum, and through duodenum it will be released. It will be excreted through small intestines, large intestines, and finally those components or xenobiotics are excreted through feces. And the third tissue where PGPs are present is kidneys. In the kidneys, particularly in kidneys in nephron, we have proximal connotative. In proximal connotative, on these tubular cells, on proximal connotative cells, these PGPs are present, which will again efflux the drugs from the tubular cells into the lumen, and through that those toxic components will be excreted as urine. So PGPs are also present in kidneys, and PGPs are also sometimes they are expressed in blood-brain barrier. Through this blood-brain barrier, these PGPs will not allow some toxins, some xenobiotics into the blood, into the brain, and they are also present in blood testis barrier. BTB means blood testis barrier. So even in that, in testis also, in the blood vessels which are present around the testis, there also these PGPs are present, which will efflux the toxins out of the BTB. So these are the tissues. PGP is present in intestines, PGP is present in liver, kidneys, blood-brain barrier, and blood testis barrier. So among these tissues, mainly P-glycoprotein is expressed on intestines. I think this point is clear to you all. P-glycoprotein. Let's go back to the question. Let me read out the question again. P-glycoprotein is highly expressed on which tissue? It is not that much present in lungs, it is not present in pancreas, it is not present in heart. Where it is present? It is mainly located on the columnar epithelial cells of ileum and colon. Ileum and colon are the parts of intestines. So they are present in the intestines. As we have discussed, along with intestines, they are present in liver, they are present in, where they are located? They are located on blood brain barrier, they are located in kidneys, and they are also located in blood testis barrier. These are different locations. So the first question answer is C. I think this question is clear to you all. Now let's go to the next question, second question. This question is also a little bit interesting. Let me read out the question. The beta 1 and beta 2 adrenergic receptor subtypes agonist acting at atrioventricular node produces following responses. In simple, the beta 1 and beta 2 adrenergic receptor subtype acting drugs, agonist. I mean simply beta agonist. Beta agonist actions or these beta actions responses, which of the following is the question. In beta agonist, we have noradrenaline, we have adrenaline, and we have isoprenaline. So these are three drugs which will act on both beta 1 and beta 2 receptors. So they are called beta agonists. So in simple, what is the action which is shown on the atrioventricular node of the heart by noradrenaline, adrenaline, and isoprenaline? That is the question. So to understand that, let me read out the options. These drugs increases contractility and conduction velocity is the first option. These beta agonists will increase automaticity and conduction velocity, and these drugs increases contractility and automaticity. Again, it increases, or those drugs increases conduction velocity and heart rate. To understand, to give answer for this question, remember, actually beta 1 receptors are present on heart and beta 2 receptors are present in lungs. Simple. Anyways, beta 2 action is not asked here, particularly the beta 1 action on the heart, especially on the atrioventricular node, what action is seen, what action is shown. So when beta 1 receptor is activated in the heart, it shows three actions. Number one, it shows positive inotropic effect, it shows positive chronotropic effect, and positive dronotropic effect. So positive inotropic effect is mainly seen with the cardiac myocyte, the force of contraction. He is asking about atrioventricular action, atrioventricular node action. So beta 1 action on the heart is increasing force of contraction. It is increasing chronotropic effect. That is, it is increasing heart rate. And it is also increasing the AV conduction velocity. Along with that, beta 1 receptors will increase automaticity of atrioventricular node. That is important. So from these options, especially in the atrioventricular node, the beta 1 actions will increase automaticity, and through that it increases conduction velocity, and through that it increases heart rate. Actually, all these actions were seen with beta 1 and especially beta 1 agonist, but particularly on the atrioventricular node, automaticity action is seen. That is the answer he wanted to get from us. So from this question, the correct answer is B. B is the correct answer. I think this question is clear to you all. We'll go to the next question. Some individuals are observed with using purgatives regularly as reflection of their psychological problem. See, actually, in most older populations, they will be suffering with constipation due to psychological disorders or whatever maybe. So in that cases, what they use is they will be using purgatives for constipation problems. What happens if purgatives are used, if purgatives are overused, is the question. Let me read out the question again. Some individuals are observed with using purgatives regularly as a reflection of their psychological problem. Dangers of purgative overuse includes all of the following except. So we will try to find out the overuse adverse effects with purgatives. So purgatives will cause some adverse effects. Among that, which one of the following is not the adverse effect is the question. So the first option is flaring up of intestinal pathology like rupture of inflamed appendix. Yes. So when purgatives are overused, what happens? Excess diarrhea is seen, excess fluid loss is seen from the intestines, and patients, sometimes what happens is, when due to loss of excess fluids, the appendix which is inflamed appendix may rupture sometime with the overuse of purgatives. So overuse of purgatives will rupture appendix. So this is the action of overuse of appendix. So this one is not the correct option. The second option, fluid and electrolyte imbalance, especially hypokalemia. Yes, overuse of purgatives will cause loss of fluid, loss of electrolytes, and through that it also causes loss of potassium and it causes hypokalemia. Purgatives will cause hypokalemia. Overuse of purgatives will cause hypokalemia. So this option is also the not correct option. And the third one, Overuse of purgatives will cause steatorrhea. This is very very important term. Steatorrhea is the condition where patient will produce pale pale yellow feces, pale yellow mucus type feces. Pale yellow mucus type feces are called steatorrhea. Actually steatorrhea is caused due to overuse of purgatives. So overuse of purgatives will cause steatorrhea. Malabsorption syndrome. Yes, purgatives will cause malabsorption. Some of the components are not properly absorbed from GI tract due to diarrhea, due to increased gastric motility and due to removal of gastric contents through purgatives. So even C is also the action which is shown by purgatives, which is not the correct option. So we need the except action, the action which is not shown with overuse of purgatives. The final one is protein builds up in the body as a result of enteropathy. Patient will develop enteropathy, that is okay with purgatives, but protein buildup is not seen with the use of purgatives. In purgative overuse, protein deficiency will be seen, malabsorption will be seen, carbohydrate, fats, proteins, malabsorption is seen, deficiency is seen, protein build is not seen with purgatives. So, when overuse of purgatives in the elderly populations due to psychological problems in the constipation, patient will develop rupture of the inflamed appendix, patient will develop electrolyte imbalance, patient will develop steatorrhea, malabsorption syndrome, but patient will not develop protein buildup in the body. So the option for question 3 is D. D is the correct option. I think this question is also clear to you all. Now let's go to the fourth question. Today in the class we were discussing about this topic. So let me read out the question. Atropine overdose may cause all the following except. Actually, atropine is a strong anticholinergic drug. Atropine is a strong anticholinergic drug which inhibits the actions of muscarinic receptors. When muscarinic receptors are activated, it will show all secretions, it will show all cholinergic actions. But when atropine is given, it will stop the actions of muscarinic receptors and through that it will show some actions. Let me read out the options. Atropine overdose may cause all the following except option A is meiosis, option B is it increases heart rate, option C is relaxation of GI smooth muscles, option D is bronchodilation. Listen, actually, atropine overdose will cause mydriasis, not meiosis. Mydriasis. The iris size will be increased when atropine is given. But when acetylcholine activity is increased, it causes meiosis. So, in first option itself, the answer is correct. The atropine overdose, what it does, atropine overdose will cause actually atropine overdose will cause mydriasis, but here it is telling meiosis because we need except answer, no? So meiosis is not seen with atropine. When atropine overdose is given, patient will develop increased heart rate. Actually atropine is anticholinergic drug. In cholinergic system, in acetylcholine action, heart rate will be decreased, but when atropine is given, heart rate will be increased. So this is the correct option. This is the correct action of atropine. Even atropine relaxes the GI smooth muscles, and by that it may cause constipation. It may cause constipation. So this is also correct action which is shown by atropine, and it also causes bronchodilation. Bronchodilation is also seen with atropine. So these three options are the correct actions of atropine, whereas option A is not the correct option. Actually, atropine is causing mydriasis, and here they have given meiosis. So, atropine overdose may cause all except meiosis. It increases heart rate, it relaxes GI smooth muscles, and it causes bronchodilation. I think the fourth answer is also clear to you. Now, the last question. Pilocarpine is classified as. To answer this, let me tell you some important points. In today's class, I was explaining the classification of cholinergic agonist. In cholinergic agonist, we have direct acting drugs, choline esters, and alkaloids. In choline esters, we have acetylcholine, methanocol, and carbachol. And in alkaloids, we have pilocarpine and muscarine. So pilocarpine is coming in directly acting cholinergic agonist. Pilocarpine is cholinergic agonist, which will show the actions of acetylcholine, which will show the actions on muscarinic Pilocarpine is classified as option A is cholinesterase inhibitor, option B is sympathomimetic, option C is cholinomimetic, and option D is cholinolytic. So among these four options, which one is correct option? Actually, pilocarpine is cholinomimetic, which is also called as cholinergic cholinergic agonist, or which is also called as parasympathomimetic. So the option is C. It is not cholinesterase inhibitor. Cholinesterase inhibitors are organophosphate compounds. Cholinesterase inhibitors are oximes. cholinesterase inhibitors are cholinesterase inhibitors are carbamates. So carbamates, oximes, and organophosphate compounds are cholinesterase inhibitors, which will inhibit acetylcholinesterase enzyme. So this is not the correct classification of pilocarpine. It is not sympathomimetic drug. Sympathomimetic drugs are those drugs which will act on alpha beta receptors of adrenaline, and it is not cholinolytic. Cholinolytics are anticholinergic drugs which are similar to atropine. Atropine and atropine derivatives are cholinolytics, anticholinergic drugs we call them. So the fifth answer is pilocarpine is classified as cholinomimetic agent. It is very simple question. And remaining sympathetic and parasympathetic questions and other questions related to asthma and bleeding conditions, I'll try to discuss the remaining questions in the next class. I think these five questions are okay to you. And yeah, before ending the session, let me tell you some important points about pilocarpine, because about pilocarpine they may ask in the next examinations. One thing is pilocarpine is a cholinomimetic drug, and it is an alkaloid which is obtained from Pilocarpus plant. So this is a Pilocarpus plant. It is a tertiary amine. Pilocarpine is used as silogogue in xerostomia. Silogogue means the drug which will increase the salivation in the patient, and xerostomia means dry mouth. Actually, dry mouth is usually seen when a patient is severely dehydrated, or when the patient is taking radiation therapy. When the patient is taking radiation therapy, especially in mouth cancer conditions or in other conditions, patient will develop xerostomia. Xerostomia is dry mouth. So in that conditions, it is pilocarpine is used as sialogogue. Sialogogue is the drug which will increase the salivation in the patient due to dry mouth. And pilocarpine is also used in Sjogren's syndrome. Sjogren's syndrome is another condition where patient will have dry mouth, dry eyes, and patient is unable to produce saliva. So in that case also pilocarpine drops were used. Pilocarpine solution 0.5 to 4% is also used in open angle glaucoma. In open angle glaucoma also pilocarpine is drug of choice. And the last point, pilocarpine is used alternative with mydriatics to break adhesion between the iris and lens. Actually, whenever a patient uses lens, artificial lens, so in that cases, when pilocarpine is used, the iris size decreases, and it is used to break the adhesion of artificial lens. Even in that case, pilocarpine is used. So these are some important points about pilocarpine. That's it for today. Thank you. We'll discuss the remaining concepts in the tomorrow's class. Thank you all. Have a good day. Good night.